This is why you need to know about fibroids. Fibroids, also known as uterine fibroids or leiomyomas, are non-cancerous growths that develop in or around the uterus. These growths are composed of muscle and fibrous tissue and can vary greatly in size and number. They can be as small as a seed, often going unnoticed due to their tiny size. However, they can also grow to be as large as a grapefruit, causing noticeable symptoms and requiring medical attention. While many women may have fibroids without experiencing any symptoms, others may suffer from significant discomfort, including heavy menstrual bleeding, pelvic pain, and pressure on the bladder or bowel. It is important to consult a healthcare provider if you suspect you have fibroids. Causes of fibroids. The exact cause of fibroids is unknown, but several factors may contribute to their development, including hormones estrogen and progesterone. Hormones that regulate the menstrual cycle stimulate the growth of fibroids. These hormones promote fibroid growth, especially during reproductive years when hormone levels are high. Genetic factors. A family history of fibroids increases the likelihood of developing them. Other growth factors, substances that help the body maintain tissues, such as insulin-like growth factors, may also affect fibroid growth. Extracellular matrix, or ECM, is the material that makes cells stick together, and fibroids, well, they contain more ECM than normal uterine tissue. This makes them fibrous and encourages their growth. Other risk factors include age, typically between 30 and 50 years, ethnicity, with fibroids being more common in African American women, obesity, and lifestyle factors like diet and stress. These may also contribute to the development of fibroids. Symptoms of fibroids: heavy or prolonged menstrual periods, pelvic pain or pressure, frequent urination, difficulty emptying the bladder, constipation, back or leg pain, and pain during intercourse, pain during management of fibroids. Medications, hormonal treatments. Gonadotropin-releasing hormone agonists can shrink fibroids by reducing estrogen and progesterone levels. Oral contraceptives can help regulate bleeding but won't shrink fibroids. Progestin-releasing intrauterine device helps relieve heavy bleeding but doesn't shrink fibroids. Non-hormonal treatments. Non-steroidal anti-inflammatory drugs can help relieve pain, though they don't reduce bleeding. Minimally invasive procedures. Uterine artery embolization is a procedure that cuts off blood supply to fibroids, causing them to shrink. Radiofrequency ablation uses heat to shrink fibroids. MRI-guided focused ultrasound is a non-invasive technique that uses high-frequency sound waves to destroy fibroid tissue. Surgical options. Myomectomy is the removal of fibroids while leaving the uterus intact, suitable for women who want to preserve fertility. Hysterectomy is the complete removal of the uterus, which eliminates fibroids, but also the ability to become pregnant. Lifestyle and dietary adjustments. Diet. A diet rich in fruits, vegetables, and whole grains may help reduce fibroid symptoms. Reducing red meat and increasing fiber intake may also be beneficial. Exercise. Regular physical activity can help manage symptoms and reduce fibroid growth risks. Stress management. Since stress may exacerbate symptoms, stress-reducing activities like yoga and meditation can be helpful.